It seems in my practice that more and more people are coming in looking for ways to both prevent and treat diseases without pharmaceutical medications. Now, nothing makes me happier than to hear people wanting to both prevent and treat diseases without just taking another pill, because that tells me they're not looking for the easy way out. So, one of the first things that we go through is the benefits of exercise. So in today's video, I want to first describe what we mean when we say get some exercise, and then go through 6 specific benefits that you can get from exercise beyond losing weight. All right, let's get started. Okay, so first, let's define what we mean when we say get some exercise. What we're talking about is a moderately vigorous activity that both gets your heart rate and respiratory rate up, but you're still able to speak without much difficulty for about 30 minutes. You want to do this about 5 times a week to get the full benefit. Now, if you're actually looking to lose weight, you probably want to increase this to about 60 minutes per activity. And if you're new to exercise, maybe you're just getting off the couch, you probably want to start with about 15 minutes and slowly increase over time. You'll still get benefit from the shorter activity length, but hopefully you'll be able to work yourself up to the full 30 minutes over time. The first benefit that I want to go through, that I'm sure most of you have heard of before, is exercise releases endorphins. Endorphins are natural hormones that both decrease pain and improve pleasure. That's why, in general, after we exercise, we usually feel better. Now, the next benefit of exercise is actually improving our energy level. Now, I know that sounds counterintuitive because, well, you're exercising and you expect to feel exhausted afterwards. But in reality, if you exercise regularly, you'll actually improve your energy level. This happens because exercise increases the oxygen delivery as well as nutrient delivery to your muscles and improves your overall energy level. In one study, 90% of people who completed regular, moderately vigorous activity reported an improvement in their energy level and decreased fatigue. The third benefit is one that I'm sure a lot of us could use these days. That is improving depression, decreasing our stress, and decreasing anxiety. Exercise has been shown in several studies to actually be a pretty good treatment for mild to moderate depression. Now, if you are feeling depressed, you might want to start with a shorter duration of exercise. That's because most people who are depressed tend to already be going through some pretty decreased energy levels and decreased motivation. So you don't want to push yourself right out of the gate. Remember, start low and go slow, and you'll improve gradually over time. You'll still get some benefit from even the shorter durations of activity, but I'm hopeful that you'll be able to increase that over time. The next benefit of exercise is especially important if you have dementia or Alzheimer's disease in your family history. Exercise has been shown to improve memory. Exercise leads to the increased expression of neurotropic factors in some parts of the brain, which then leads to improved memory and improved cognitive function. Exercise also can improve certain chronic diseases, such as diabetes, heart disease, including both high blood pressure and high cholesterol, as well as it's been shown to improve cancer rates. The biggest benefit here is probably going to be on diabetes and heart disease. By increasing your cardiovascular activity, you're going to decrease insulin resistance, which should lead to an improvement in your diabetes if you suffer from that. Exercise also leads to a decreased blood pressure overall, as well as improvement in your cholesterol, including decreasing your LDL cholesterol, or the bad cholesterol, as well as triglycerides, and it leads to an increase in the HDL cholesterol, or the good cholesterol. So, exercise definitely has a benefit if you suffer from any of these chronic diseases. It can also help with others as well. Now, the final benefit of exercise is one that we're all looking for, and that's to live longer. At least, I hope that's what you're looking for. Moderately vigorous activity has been shown to improve life expectancy over time. And luckily, it doesn't matter when you start. Even if you start later in life, you can still see improvement in your life expectancy. And I hope that's a goal of all of ours, to live longer. Now, how do you make this part of your daily routine? Well, I usually suggest to my patients that you add it to your schedule, if you're one of those that keeps a schedule. Put it on your calendar. Don't hit snooze or ignore it. Treat it like any other meeting that you have to go to. Another thing that might help with this is having an accountability partner, someone who can hold you responsible if you try to skip your activity that day. You might even want to actually exercise with that person. Might make it more fun. Okay, that's all I have for you today. I hope you found this video beneficial. Leave me a comment down below and let me know what you do for exercise, or if you're just getting started. I hope you'll consider subscribing to my channel. Hit that like button. It helps other people see this video. And as always, be safe out there.